Hello, and thanks for joining me today. My name is Cindy Logan, and I'm one of the 4 science librarians over at Hale Library. Today, I'd like to talk to you about a resource that you have access to through the K-State Library's website. So let's start there first, okay? We are at the library's website, and you can Google K-State Libraries, or also you can bookmark, which is my recommendation, the URL lib.k-state.edu. Once you are on this page, what I want you to do is scroll down until you see the box that says databases. This will take you to all of our resources that we subscribe to, as well as some of the free ones that we have. Since we're going to look for UpToDate, I want to go to the alphabetical listing just under the banner and select U, and then scroll to the entry for UpToDate. So what is UpToDate? UpToDate is an evidence-based clinical decision support system designed to provide current and comprehensive medical information. It is used by clinicians and other healthcare workers worldwide to make informed decisions at the point of care. So why do we like to use UpToDate? What benefits are there? One, it provides access to current evidence-based information. It is continually updated with the latest research and guidelines, and this ensures that the information you will access is current and evidence-based. By using UpToDate, you can stay informed about the latest developments in medical practice and apply the most effective treatments and interventions for your patients. Also, besides it having current evidence-based information, it also will help us improve patient care and outcomes. Studies have shown that UpToDate can improve patient outcomes because clinicians who use UpToDate are more likely to adhere to evidence-based guidelines, leading to better patient care. The information provided is thorough and reliable, helping you make informed decisions quickly, which is crucial in the fast-paced clinical environment. Third, UpToDate is very comprehensive and user-friendly. UpToDate covers over 11,000 clinical topics across more than 25 specialties, making it a comprehensive resource for a wide range of medical conditions and scenarios. The platform is very user-friendly, which allows you to quickly find answers to clinical questions. This is particularly valuable in situations where time is of the essence. And lastly, UpToDate supports continuing education. I'm going to move my screen. There we go. UpToDate offers current medical education credits, CME credits. As you use the platform to answer clinical questions, you would also earn CME credits, supporting your ongoing education and professional development. This makes UpToDate not only a point of care resource, but also a tool for lifelong learning. So let's take a moment and look at how to use UpToDate effectively. From this search bar, you are able just to put in your question or your terms. So we're going to do something with hypertension. So let's look at hypertension treatments. The list that will come back will be listed in hierarchical order with the most relevant topics that answers your question or comes the closest to matching the terms that you put into the search on the top. If we take a look at this, we will find along the left, there is a table of contents. One that's the first thing that's listed, although not the first thing on the right side of the sheet, or the right side of the screen, is summaries and recommendations. If we click on that, you will see that it took me right to that summary and recommendations. Usually when you'll be seeing a client or a patient, you will look for that information first. Oops. So you can read through that and you will see that it is hyperlinking to other articles within UpToDate. As well, it would also provide you with some support on the level of evidence. So, for example, let's look here in this information. It has this grade 2B hyperlinked. Let's take a look at that. Looking at that, grade 2B recommendation is. It initially tells us it's a weak recommendation, and then some alternative approaches may be better for some patients under some circumstances. It will define here what a grade 2 recommendation is. Again, it states that it is a weak recommendation. And a grade B means that the best estimates of the critical benefits and risk come from randomized controlled trials with important limitations. So if we go down further, we will see in comparison what it could be. So it tells us what, like say a grade 1 would be as a strong recommendation, as well as then the evidence grades. And A is high quality evidence, B is moderate quality, and C is low quality evidence. So as you're reading through your information in UpToDate, you can refer back to that listing to know what is the level of evidence and what is the recommendation based on it. And grade is just a type of, I hate to use grading, but a type of grading system. It's a way of evaluating. There's also one that's called SORT, S-O-R-T. So there's varying ones for different situations. One of the other things that is valuable and UpToDate is the amount of patient information. So if you were seeing a client or a patient, you can click on the information for patients, and here is some information. It will tell you that they have 2 sets of information, the basics and beyond the basics. You'll notice that the basics was written in plain language for 5th to 6th grade reading levels. And the beyond the basics were written for the 10th to 12th grade reading level. And if you keep scrolling, you can then click on that information. This information can then be printed out for your patient and given to them to take home to further explain their situation. As you can see, UpToDate is a fairly easy resource to navigate with a lot of information that is all based on evidence-based practice and thoroughly reviewed by clinicians and specialists in that area. It is invaluable, as I was saying, for healthcare professionals. It provides access to current evidence-based information, and it improves patient care and outcomes. It's comprehensive, user-friendly, and supports continuing medical education. I hope this information has been valuable on how to use UpToDate, and be sure and ask any questions that you ever have regarding the use of UpToDate or really any of the library resources. Thank you for joining me today and have a pleasant day.